It's been a long ride, but Stephen Grant finally recovered from COVID-19.
I had the headache, the fever. I had issues breathing. So if I was sleeping on my side or on my back.
Grant caught the virus in April, and it took 2 months to recover. In all that time, no one could figure out how he got it.
Co-workers of mine, family relatives, and everyone else panned out they were okay. So we're not really sure where it could have came from.
There are currently more than 2,300 active cases of COVID-19 in Ontario. An analysis by CBC News reveals for 54% of those cases, it's unknown how exactly the person was exposed to the virus. And according to this epidemiologist, that's a problem.
If we understand where people are getting infected, how they're getting infected, it makes it a lot easier to control. And unfortunately, at this point, we just are missing a lot of data there.
And so many cases unaccounted for now spells trouble for the future.
And this is really just the start. It suggests that we're going to be in for a pretty rough fall and winter if we can't figure this out.
As rules have relaxed, some have let their guard down, getting too close, expanding social bubbles. And as the numbers of cases with no direct link rise, public health officials are repeating what has become a COVID mantra.
We can't take our eyes off the target. We have to keep doing our distancing, wearing our mask.
But Stephen Grant can't help but think that knowing how people like him got infected might help too.
I would be happy if I knew where I could have got it from or how I could have prevented myself from catching it.
But for now, all he can do is follow the rules and hope he never gets COVID again. Katie Nicholson, CBC News, Toronto.